Okay. I am very happy to welcome you again to this third session of our Women and Gender series. Before we introduce our speaker for today, and my colleague Hatoun will do that, I thought I would reintroduce the series for those who are attending for the first time. So the concept of this series is really, let me also admit some people who are waiting, is really to explore the imagination and representation of Arab and Muslim women in history as well as in the present time. To do this, we have taken an inter and a multidisciplinary approach to tackle or approach this subject from multiplicity of locales as well as angles. So you will see that our speakers sometimes would speak about literature, history, bioethics, like today's medicine. So we are really a multidisciplinary, interdisciplinary forum, and we are speaking from multiple locales. And today we have people attending from so many parts of the world. So this is the important feature, I think, of our forum. So what we are going to do is really defy boundaries of geography, of race, of class, and gender. So gender is often mistaken as being a woman's thing only, but our forum also includes men as speakers, as members of our forum, etc., etc. So far, we have run 2 lectures. The first lecture was presented by Dr. Hasna Mukhtar from Rutgers University in the United States, and she spoke about women in the Arabian Gulf. The second lecture was presented by Dr. Lloyd Ridgen from Glasgow University on the hijab between empowerment and disempowerment. Next week, we have Professor Fatima Saddiqui, who's going to speak about Amazigh women's art. And today, we have the honor to welcome Ruaim Muaygil, who is currently in Riyadh, but is located in the United States. And I will leave the introduction of Ruaim to my colleague Hatoun. Thank you for attending again, and I look forward to the discussion and the paper.
Thank you very much, Professor Zahia. It's my pleasure to present Ruaim Abdullah Muaygil, who's an assistant professor of healthcare ethics at the College of Medicine at King Saud University, and a clinical ethics consultant at King Saud University Medical City in Riyadh, Saudi Arabia. She's a member of multiple national bioethics committees, including the Saudi Arabia Saudi Health Council and the Public Health Authority. She also serves as an advisory counselor to the Secretary General of the Saudi Commission on Health Specialties. She has several published works and speaking engagements, particularly on the intersection of clinical feminist and Islamic bioethics. She obtained her medical degree from King Saud University in 2008, a master's of bioethics from the University of Pennsylvania in 2014, a clinical fellowship in bioethics from California Pacific Medical Center in 2015. She was certified as a credentialed clinical ethics consultant by the American Society of Bioethics and Humanities in 2018. I am proud to have been part of her PhD committee at St. Louis University, from which she honorably received her degree in healthcare ethics in 2018. I should add also that Ruaim comes from a house of learned mother and father, Professors Aziz Al-Maneh and Abdullah Al-Muaygil, both in foundation, in education and literature. But Ruaim chose a distant discipline, medicine. However, she benefited, as we see, from the literary cultured house in her approach to medical ethics and Islamic feminism. Without further ado, I'll invite Dr. Al-Muaygil to give her presentation in 30 minutes entitled Muslim Bioethics Reimagined Towards an Islamic Feminist Practice. Ruaim, the floor is yours, and if you want to share your screen, go ahead.
Absolutely. Just give me 1 second. Okay, can everybody see the screen?
Yes.
Okay, great. Well, first of all, thank you so much to the lecture series, the organizers, for inviting me, and thank you specifically, Dr. Hatoun, for the wonderful introduction and for helping organize this as well. I'm very honored to be part of this today, so thank you very much. So what I'm going to talk about today is I'm going to talk about particularly my discipline, which is bioethics, and some of the limitations that I have found in this specifically Islamic bioethics, and how I think Islamic feminism as a project might actually really help and contribute to Islamic bioethics as it starts to find its footing as a standalone discipline. So to begin, I'm not sure if everybody here is familiar with what bioethics is and what bioethics practice is. So what I'm going to do is I'm going to talk a little bit about that. And so bioethics is actually a fairly novel discipline in the sense that it developed in the 1960s, late 60s to the early 70s. And it developed really as a response to multiple healthcare advances that were happening at the time, as well as multiple research ethics violations that became popular, as well as multiple clinical ethics situations that really gathered public attention. So what it is, it's a normative approach, really. It's also very multidisciplinary, and it's aimed at studying the moral and ethical issues that occur with science and with medicine. So if I were to give an example, things like vaccines or vaccine mandates that we're all in the world struggling with right now, these are things that an ethicist would be heavily involved in, as well as things like organ donation. So who can donate an organ, who can receive an organ, and what are the ethical considerations in doing that? Things like life-sustaining interventions, when to discontinue life support, who is eligible for life support and who isn't, and who gets to make that decision, really. And then as medicine develops, we get into things like neuroscience and genomic medicine and all of these novel questions that are happening. And so a lot of ways, ethics is about research. It's also about public health. It's about the clinical work, for example, the work that I do in a hospital, as well as things like environmental ethics and then biotechnology. So that's pretty much bioethics in a nutshell. So moving on now, I'm going to talk a little bit about Islamic bioethics. So Islamic bioethics, in a lot of ways, is just a response or trying to respond and understand these ethical dilemmas in healthcare, but from within a purely Islamic tradition. So when we think about organ donation, we can think about all the ethical considerations about donating an organ. Who gets to donate an organ? Can children do it? Can people who do not have capacity, can they do it? And these are all ethical and moral questions. What Islamic bioethics does, it tries to figure out, well, is this permissible? Is this permitted under Islamic law? So the idea with Islamic bioethics is to give guidance specifically to Muslim patients and to Muslim practitioners and Muslim communities as well. So its methodology is very much direct and exclusive in the sense of applying actual Islamic scripture to ethical dilemmas. So it's very concrete in that sense. And what I want to argue today is that, and I've argued before, is that that methodology makes Islamic bioethics very limited in a lot of ways. Because as you would imagine, when we are going only and exclusively to the text or to the, let's say, legal permissibility, we are just completely legalistic in our thinking about a certain topic. We don't do any of the moral examination or any of the contextual interpretation or intellectual engagement, right? So let's go back to our life-sustaining intervention example. If you were to read a text on Islamic bioethics, it would usually say that, discontinuing life-sustaining intervention for someone that is not going to benefit from it is permitted under Islamic law, because continuing this intervention is going to cause more harm than good. So it is permitted and it's not considered ending a life in that sense. And that's fine and that's great, but that's merely a starting point. It doesn't go deep enough. It doesn't tell us, who gets to make that decision? Is it the physician? Is it the family? Do they get to make it together? Or is it the patient? What if the patient, told us before he got sick what he wanted to do? Do we listen to what the patient said? Another consideration is, well, what if a hospital doesn't have enough resources? Or what if this patient's family agrees to withdrawing life support, but they want to wait a few days until a distant relative comes to visit this patient? Can the hospital wait? And so all of these moral questions, these like things that are related to the context, to the case-by-case questions, cannot be answered by a simple legal question of, is this permitted or is it prohibited? That gives us the beginning, but it doesn't go far enough. So that's one issue. The other problem that I think a lot of critics have faulted Islamic bioethics for is its lack of conceptual clarity, in the sense that many Islamic bioethicists, when they write, when they publish, when they speak about these matters, they simply point to the primary sources. Here we're talking about the Quran and the Sunnah, and they choose isolated verses or ayat and assume that these are self-evident. They don't really tell us how the normative argument, how the normative claim is derived from this verse. And they don't really tell us how they came up with these interpretations, or how these interpretations, happen to come up, and how they apply to this very modern discipline right now. So there's not a lot of clarity here, and it does leave the reader maybe wanting a little bit more. The other problem with Islamic bioethics is it does seem to be a little bit essentialist and reductionist, in the sense that whenever you read an Islamic bioethics text, it always says things like, Islam says XYZ on this matter. The Islamic faith permits XYZ. And it presents Islamic tradition as this really uncomplex monolith, as if, everybody who belongs to this faith believes the same thing. And it really doesn't represent any of the internal diversity that we all know is quite common within the Islamic faith. So when we have this kind of exclusive discipline, what it does is it gives one voice on a very complex bioethical matter. And we know that bioethics as a discipline needs to be multidisciplinary. It needs to have a lot of different voices. It needs to have conversations. It needs to have debates in order to grow and flourish as a discipline. That is what bioethics is. But what ends up happening, or what has happened here, is that we end up having the opinions of very few legal scholars that are presented as the only acceptable Islamic position. And what often happens, unfortunately, is these legal scholars, as is often the case, are usually men. So what happens is a lot of issues that maybe concern women tend to be a little bit marginalized. So women scholars end up being excluded from this particular interpretive project of Islamic bioethics. And when I see this in practice, I realize that women's health interests end up being forgotten or neglected. So what ends up happening is when these authors or these Islamic bioethicists end up giving these opinions, they're often under the influence of these patriarchal traditions, patriarchal understandings, and they tend to appear to encourage the same animalistic treatment of women, as well as the disregard of their wishes and the dismissal of their experiences of illness. Okay.
So, could just a second. Could everyone please turn off their mute themselves, basically, because their voices are interfering with Ruaim's talk. Please.
Okay, so as I was saying, what ends up happening is that the interests of women end up being marginalized. And through, this is obviously not an exhaustive list, but what I have done through my work is I have come across multiple publications in Islamic bioethics. And I should say that Islamic bioethics as a discipline is not only novel, but the scholarship is actually very limited. So there aren't a lot of publications on Islamic bioethics. And when I do find them, they often really misrepresent women's interest. So, for example, there are a lot of articles talking about how women tend to like or to want or to prefer to defer to their male relatives during decision-making. Other articles that encourage physicians to listen to fathers only and not mothers in Muslim families. Multiple articles on autonomy and agency and how women don't value autonomy in cultures, and how that shouldn't be stressed as much as it is in Western societies. A whole slew of articles on cross-gender interaction and modesty, and how, if you are a woman, you should definitely only ask for a woman physician, and if you can't find one, then it's okay if you find a man, but you should do this and that and that. And it really presents it in a very limited, very sort of difficult position as well. Things like surrogacy, which I have written about, things like hymenoplasties, reproductive choice, female genital cloning. All of these topics have been written about by male Muslim bioethicists, and they have really presented, I think, a picture that does not do justice to women's interest in Islamic bioethics. I just want to share snippets of a book that we are currently in the process of revising, thankfully. But this is a textbook that was developed for residents. It's a code of ethics, and I've highlighted a few sections that show you how much these tend to disregard women's interest. So if you look at sort of the last section, it talks about a woman who was brought to the emergency room who is refusing treatment for whatever reason. They don't even tell you why she's refusing treatment. So we don't really know what her reasons are. And so they continue to say that if she continues to refuse to sign the informed consent form, then her husband or another relative may sign for her. Complete disregard for her reasons, complete disregard for her agency, for her autonomy, doesn't even really tell you why this woman is refusing, completely infantilizing women. And this is something that is taught to residents, in a Muslim majority country. So it tends to be very upsetting. And then the first section talks about women's consent. And I mean, the whole idea that there is a particular section for women's consent on its own for me is baffling. But it goes and talks about how women should be able to give consent for anything except for anything that has to do with reproduction. Then you must absolutely obtain the consent of the husband as well. This is including even over-the-counter sort of oral contraceptives as well. So, but this is just an example of how when you have a discipline that is dominated by one section, how the interests of the other people in it are not as well represented. So what ends up happening is that bioethics doesn't ultimately sufficiently address the moral dilemmas in healthcare. And that is the main goal of bioethics in any place, is to address these moral dilemmas. And it's unable to respond to the needs of its patients, to the needs of the clinicians who practice medicine. And it doesn't, of course, fulfill the ultimate goals of bioethics, which are patient empowerment and advocacy. So what I have been proposing for a few years right now, what I've been working on for a while now, is a new theoretical framework. I think this is really important for it to blend the legal aspect that we get from our Islamic tradition, along with the philosophical, the moral, and then the social consideration. And I really think that Islamic feminism is an interesting model, and it's a model that Islamic bioethics could utilize in its development. So what is Islamic feminism? Islamic feminism is just a feminist discourse within an Islamic framework. In other words, women here want a piece of the interpretive action, right? And so in general terms, in broad terms, I'm not gonna go into details about what Islamic feminism is, but in broad terms, what Islamic feminists want is they want to critique these culturally constructed and historically informed interpretations, the ones that we have all just taken for granted and have accepted as absolute truths, right? So they want to reverse this modern day exclusion of women, and they want them to get these spaces once more. So they argue that women used to be interpreters, they used to be scholars, they used to take part in these practices, but they have been excluded from these spaces. And that is why women's interests are neglected. So the Islamic feminist methodology, I'm going to sum it up for these purposes in sort of in 2 points. One is there is a particular distinction between the divine prescriptions and the human elucidation. So difference between Sharia and fiqh. And so what they focus on is going to be the latter, right? So they want to approach things with this transformative readings of the scriptural resources so that they can create new understandings that will help us shift from this essentialist basic understanding of a verse in isolation to the contextual examination that considers the entire overall moral vision. So instead of just reading a verse and understanding it as it is, they want to understand the context in which it was revealed, what were the reasons, what was the ultimate goals, and then use that to understand and to respond to the moral dilemmas in our modern times. But also they really believe that there is a certain authority and a certain power to having women into doing the interpreting in these particular incidents as well. So before I go to see what that would look like, Islamic bioethics learning from Islamic feminism, I do want to address 5 critiques of Islamic feminism that I think might be that might occur to some people as well. So I'm going to go through all of them in 5 slides. So the first critique that I often hear about Islamic feminism and its project, let's say, is that the Quran's message is clear and is unchanging, and that what Islamic feminism is trying to do is trying to, ascribe contemporary meaning, like newfound, new world meaning to religious scriptures. And these efforts, are very inappropriate, and they might also be irreverent, and that we shouldn't be doing this. And so the response that not just me, but a lot of people have given to this is that, everything we know, all our knowledge of Islam is actually humanly constructed, right? Everything we know is based from interpretations of learned men, mostly, usually. So it's inaccurate to assume that there is one unchanging, constant virgin, right, of the faith. And that these absolutist understandings really do neglect the role of fiqh. We know that fiqh is shared, it's accessible, and it's deliberative. People should have access to them. They should be able to consider these things as well. So interpretation is not exclusive, is what Islamic feminism tries to say. And ultimately, what feminism or Islamic feminism wants to do is not really new meanings, like this charge is saying, but more of a broader comprehension. And I think this really works in the realm of bioethics. It's trying to get a better understanding of the overall moral claims in the text that we are reading. The second critique is that Islamic feminism is an oxymoron. And so what this one says is that really religious systems are fundamentally incompatible with a secular understanding of freedom, right? So this is, feminism is, when did feminism emerge in its modern sense? In the late 1960s, how is this compatible with an old religious system? Islam and feminism specifically have very different historical, social contexts. They have distinct sources of authorities. They have different processes, different outcomes. How can we claim that there is such a thing as Islamic feminism? And the response to this is that, Islamic feminist practice is not radical, but what it actually does is continue this really long tradition of women working in Islam. So we know that there has a long history of women scholars, of women interpreters, of women that have really played a significant role in the growth and the development and the evolution of the faith, and have worked to empower women over the centuries. So the idea to say that the idea of Islamic feminism is novel is really flawed here, because we have this history of women working to these same outcomes. The third charge, which I think is really interesting, is the idea that feminism is inherently Western. And that's fine to say that feminism originates from this Western emphasis on human rights, while Islam is an Eastern tradition, and how can these two things be compatible? And why I think this is interesting is because this is a charge that I often personally encounter, whether when I was studying in the United States or even now currently in my practice. And I think what I always say is that I don't think it's fair to say that Western feminism has some sort of autonomy over the particular values that it has, things like autonomy or equality. It's unfair to say that these belong exclusively to Western feminism, and especially in a global society like ours, where you really hard to say that one value, belongs to one culture, but not the other. And that's not something that I think is acceptable anymore, or is even accurate anymore. But more to the point, I think Islamic feminism represents a different kind of feminism, right? It's a feminism that is enriched and it's empowered by both Islamic tradition as well as these so-called Western feminist values as well. The fourth critique, which I think might be a little bit accurate to a certain extent, but I'll still try to respond to it, is that Islamic feminism is elitist. The issues, the forums, the scholars do come from a privileged education and a privileged class. And I do think there is some truth in this claim because it is largely an academic discipline, right? However, having said that, the efforts, the goals, the applications are concerned with a larger group, and with the community at large. So its value, even though it originates in an academic setting, hopefully extends beyond that, beyond a different setting. And at the end of the day, Islamic feminism doesn't really force or try to force women to accept any of its values, but rather wants to open doors and create opportunities for all women as well. So this is sort of my response to this particular charge, but I'm interested to hear what you guys think about it as well. The last critique is actually my favorite critique, and it's one that I did grapple with to a certain extent, and it comes from Audre Lorde, the American sort of women's rights author, and she was talking about the women's movement in the United States in the 1960s, and she had critiqued it by saying that this movement is, it's very exclusive in the sense that these were all white women, privileged women, and they were ignoring and not including women of color. They were not including LGBTQ women, and they thought that what they were doing is that they were embracing the master's tools, which she felt was the oppressive patriarchal system, and using it to include themselves but exclude these other women. And so she did not think that this was helpful. And she kept saying that if you subscribe to the same oppressive system, you are not going to dismantle it. You are never going to overthrow this oppressive system if you continue to use the same approaches and exclude other women from the project. So if we were to apply it to our particular case, you could say that working from within the context of religion may not be helpful. Why? Because interpretation in the past was used to subjugate women. So how can it also be used in their emancipation? And I think that's a very interesting question, but I do want to respond by saying that for Lorde, the tools were inherently oppressive. The system of patriarchy itself was oppressive. So it does make sense to say that working within that system or embracing the values of the system is not going to be helpful. However, for Islamic feminism, the tool itself, which is fiqh, or the interpretive project of fiqh, is neutral. Actually, one could argue that this is a neutral ground that women were forced from. They were expelled from by force. And what women are doing are merely reclaiming something that they used to do, something that they used to practice. It never only belong to the masters or to the men in this context. So that's the response that I would give to this critique. So what does a Muslim bioethics look like? So it's two things. It's Islamic and it's also, yes.
5 minutes left.
Okay, I'm wrapping up. So it's both Islamic and it's feminist. So it's Islamic in the sense that it's very familiar with the moral foundations of Islamic legal tradition, and ends up using the religious rulings to ethical situations. So we don't want to exclude the Islamic tradition from this practice. We don't want to exclude the legal tradition from this practice. We think that's really important, but we want to add to it this feminist standpoint, which for me is most importantly recognizes gender as a moral standpoint, which is very important in something like healthcare and access to healthcare. And so most importantly, we recognize the bioethical dilemmas are not gender neutral. The situation, even if it's exactly the same medical situation, does not apply the same to a man versus to a woman. Things are different. Dilemmas are not neutral. And that's why we need to have everybody participating in the conversation. I'm going to do a case study very, very quickly about the prohibition of surrogacy in Sunni Islam. So most Muslim scholars, Sunni Muslim scholars specifically, will prohibit surrogacy. And what surrogacy is the carrying of a fetus by a woman for a couple that is unable to carry a child to term. So it has been prohibited in Islam under three arguments. The first one is under the argument of preservation of lineage. So people who prohibit surrogacy say that, it's very fundamental to Islamic law to not have any potential to gene mixing, and that having a surrogacy arrangement leads to a lot of gene mixing, and that's why it is prohibited. The second argument goes under the third party involvement. So under Islam, the argument is the privacy of the marriage is very paramount. It's only between a woman and her husband, a husband and his wife. And so when you have a surrogacy arrangement, another woman carries a child for you, you are bringing somebody, a third party, into the sacred marriage pact. And then the third argument is about the rights of the child, arguing that under Islamic law, a child born to a married woman is legally considered the child of her husband. And then if you have a child born to a surrogate who is married, then that child would be hers and her husband's and not the intended parents. And so these are the arguments that Islamic bioethicists use to prohibit surrogacy. Now, an Islamic re-interpretive approach would look at the following arguments this way. So it would say, for one thing, lineage does not apply to gestational surrogacy, where the genetic material comes from the mom, the mother, and the father, and the fetus is then placed in the womb, where there is no mixing of genetic material, there is no sharing of genetic material. So then we don't have this argument anymore. As for the third party involvement argument, well, uterine transplants have been permitted by Islamic scholars. Wet nursing is obviously permitted in Islam. And these are all parallels where a third person comes in and nourishes and helps support a couple to have a child. So there are certain parallels here. The third one relates to the rights of the child. And this is really the one that I think elucidates the contextual argument really well, because when we think about how within Islam, the child born to a married woman is the child of her and her husband, well, that one had a very specific context, the context of adultery right here. But if we're talking about the emphasis on lineage and how, in sort of with developed medicine, we know DNA and genetics, and we know that the genetic parents are the child's parents, then this argument would not stand. Genetic parents would be the legal parents. Now, this is just an example about how having context and having more information, whether from the social context or the medical context or any parallels, anything else, helps us come up with sort of different visions for certain novel ethical situations. So this is my last slide. I'm going to wrap up. What would be the implications of an Islamic feminist bioethics? Well, I think that it's going to be more representative of the needs of Muslim patients and clinicians, so not just women, but specifically, I think it establishes a space for Muslim women within healthcare that I do not think that I have so far. I think it also helps women can reconcile their faith with their feminist identity, and I think that's something that is often challenged for Muslim women, at least. It also doesn't neglect Islam, so it highlights the unexplored richness within the faith, and it's very much capable of sustaining a very robust bioethics discourse and bioethics dialogue. It also helps, I think, support the efforts of a more global feminist bioethics. Okay, well, that's it from me. Thank you for listening, and I think we can turn it to the questions, right?
Yeah, yeah, okay. Thank you very much, Ruaim, for this provocative piece. I feel a bit unable to comment properly because maybe of your shocking example that you have chosen to give. I thought that you would give something that is more currently usable, something more accessible, something that, especially that you're talking about the Saudi cases, that this is something that is happening. Do we have surrogated mothers in Saudi Arabia, or even
no? No, and I think that's the idea here, is that Islamic bioethics has completely neglected surrogacy as a topic that we don't talk about at all. And I think that is the issue, is because we have just seen it and gone, nope, that's prohibited, and we have moved on without giving it further consideration.